you guys probably mostly know me. My name is Holly. I am one of the practitioners with Be Well Clinic. And I'm sitting here with Dr. Courtney Gilmer.
Hey, guys.
Who's the chiropractor. If anybody has been here to the North Glen office, you have gone through her territory downstairs. So she runs and owns the chiropractor office downstairs. And so I get to see her every day and talk with her and have her adjust me and adjust my kids and my husband and yeah.
Sometimes eat lunch together and bounce ideas off each other.
Yeah.
It's awesome.
Yeah. So we were really excited to just get together and have this time to chat for kind of both of our audiences, for the people who know both of us. Just to talk about why chiropractic care is really important for specifically the pregnant and infant populations. Thanks.
Finish each other's sentences. I'm just kidding.
Yeah, so that's what we're going to talk about tonight. So Dr. Courtney does pretty much everybody, birth to 100, men and women, but her primary care is with pregnant women and with children. And so that's how I actually started going to her with my last pregnancy. And then she saw me all the way through, and then adjusted Everett, my son, who's now almost 1.5, when he was a newborn. I don't even know, but probably a week or two old. And that's how I started getting into, or kind of learning more about chiropractic care in infants, because I have been to chiropractors since I was about probably 12, just different ones, kind of like, oh, my back hurts, I need to go to a chiropractor. And then I would go and then go find another one the next place I lived, and then another one the next place I lived, and just kind of did it like that, and didn't really have consistent care or really understand why I needed chiropractic care and what it could do for me. So anyway, that is what we are here to talk about today. So Dr. Courtney, go ahead. You want to just tell everybody about yourself a little bit?
Sure. You did a great job, though. So I am Dr. Courtney Gilmer. I own Kindred Family Chiropractic. Like she said, you've probably walked through my office, and that practice exists to serve families. So I have 2 little ones. And my daughter happened to be a very high-strung baby. And so if I had to go to an appointment and keep her in her pumpkin seat, like that would not have been a good thing. And so if you've walked through my office, or if you ever see it, there's toys everywhere. We have bouncers, swings. It exists to make it as easy as possible for families to get care and for no one to feel stressed just coming in. So that's our heart. And like Holly said, I have a lot of extra training in pregnancy and infancy, which is where my heart is. And let's see some background. So my husband and I have 2 kiddos ourselves. And like I said about River, my daughter, and we had 2 beautiful, successful home births on purpose. Yeah, I know, you have to like preface that. Yeah. And so that even more so, like really just floored me for how incredible like women's bodies are, and how amazing it can be when they're empowered and have the right tools, and how incredible it can be. So that's been a huge passion of mine for a long time, and another focus that we have in the office. So that spurs from my experiences, and yeah, it's awesome. So that's a little bit about my practice anyway. So, and then background. So actually a fun fact, Holly and I actually went to the same undergrad, but we didn't know each other.
Yeah.
So that's my husband and I met in Virginia, and then we're back to Colorado now. So yeah.
I did forget to mention, if anybody has questions, go ahead and you can put them in the chat. And I'm going to try to keep a really close eye on the chat. There's a little bit of a delay, so if I don't get to you immediately, don't fret. I will get to it. But yeah, so any questions, feel free to shoot them at us. Okay, so I'm curious about your story, because I've heard it a little bit, but why you got into chiropractic care, like in particular.
Yeah.
Yeah.
So when I was about 9 years old when I started having neck pain. And so we went to my pediatrician, and he actually x-rayed me, which I'm glad he even listened to a 9-year-old being in pain. I feel like that gets just kind of written off a lot. Like, kids don't experience those things. And so the x-ray showed that I had a pretty significant scoliosis. So that's a curvature of the spine. And I was about like 10 degrees away from when they would recommend surgery or more like invasive procedures. So we ended up going to a children's hospital, and I got a brace because that's the normal protocol. And I had to wear that for a couple of years, and it was hot and it was uncomfortable, and it didn't actually help with the pain at all. It was more of a structure thing. So flash forward to years later. This is kind of the funny random part of my story. So we had to take a assessment test in high school, those career assessment tests. And I always knew I wanted to be some kind of medical practitioner. And I had this fascination with the spine just from having that exposure whenever I was younger. And so in this assessment test, chiropractor was one of the things that came up. So I'd never heard of a chiropractor before. So I clicked on it and started reading about it. I'm like, this is exactly what I should do. This is fascinating. It's all about the spine. And so that particular year, we could do a school to work job. So I ended up getting a job in a chiropractic office. That was the first time I'd ever actually been adjusted. And it was so incredible to actually feel relief for the first time and actually see how my body could feel. Like I had all these years in the brace, and this is what I was supposed to do. That didn't actually help me with the pain at all. And then even within one adjustment already feeling so much different, so much more movement. And I just knew that's what I wanted to do. So I never wavered from there, loved working there, and then went to undergrad and got my pre-med degree, and then went right to chiropractic school. And in chiropractic school is when I really started figuring out that, number one, chiropractic care doesn't have to be about pain, which I think most of us would assume. So, and also I had no idea how expansive it could be and how many different things you could focus on. So in that realm, I was trying to figure out exactly what would be my niche. And I think I always kind of thought about that little 9-year-old girl that I was, where I wished like I could have figured this out sooner. I wish that I could have had more options sooner. It's just not something my family knew about. And so how could I get to that girl way before she's experiencing pain at 9 years old? And so, of course, like infancy, like is a thought, but then even more so, and I know we're going to talk about this in a little bit, is in utero. Like there's a lot that happens in utero. So if I can impact a mama and a baby as soon as possible, then what are the chances that they might not have to experience these things, or can do it in a way that they are more comfortable or more empowered about what their body can do with maybe not so many interventions. So that's kind of how I got the focus that I got and how I got into it in general.
Yeah, I love that thought, because I think a lot of times people, myself included, just think of chiropractic in pregnancy for the mom and for all the aches, the sciatica, that kind of stuff, which it totally is. And it helps a ton.
Super effective for that. Absolutely.
Yeah. But then also for the baby, like what are you actually doing there? Yeah. Tell me, like, what are you, for the baby in utero, what are you actually doing to help out?
Sure. So brought my handy dandy pelvis so we can talk a little bit about pregnancy care, because I feel like it always helps to have a visual. So even starting with, why would a pregnant mama need adjusted? So, I mean, that one's kind of easier to understand, because you know how much the body's going through in pregnancy. Your center of gravity is changing so much. So you have this belly. Holly could be your model right now for that. I know. Center of gravity changing. So you already have that going on. You already have hormone shifting. You have different weight distribution of your joints. You have all the things that are more obvious. So I'm certified in a technique called Webster technique. And this is a technique that focuses on the sacrum. So even just looking at the pelvis here, here's the sacrum. You can see why sacrum would be so important with a growing baby in there. So with that, there's a lot of connecting points to sacrum in uterus. So sacrum literally connects uterus with the sacrouteral ligament. And then also the round ligaments, which every mama who's ever been pregnant knows those ligaments, hates those ligaments. Those ligaments connect to the pubic bone here. So you have a lot of connecting sacrum to uterus, uterus to pubic bone. So it's really important to actually understand the structure of it, so you know you're impacting more than just the joints. So in that, with Webster technique, let's talk about relaxin, which is the hormone that stretches everything. So when relaxin starts surging, and in the end stages of pregnancy, it's super useful. You need everything to open. It's the hormone that opens everything up, stretches out ligaments. And so you need that at the end. You need everything to be open as possible to have the best birth as possible. But before we get to that point, when it's surging throughout pregnancy, if you can think about the ligaments starting to stretch out and become a little bit looser, and if you want to start with sacrum, you have these, they're called SI joints, the sacroiliac joints, and there's a ligament here, and when those open up and stretch and rotation happens, that's where the sciatic nerve is. You can get sciatica, like Holly was just talking about, and that can be super uncomfortable. And then we talk about the pubic bone. So the symphysis right here, again, relaxing can cause it to stretch a lot, which then can cause one side to come up more than the other, which is very uncomfortable. A lot of mamas feel this when like rolling over in bed or when getting out of a car, any of those openers. And a lot of mamas affectionately call that lightning crotch, which definitely is accurate. So when that happens, so we always check this and see if it needs adjusted in pregnancy as well. And so those are even just some ways mamas can stay comfortable. But when it comes to baby, if you're having rotation of the sacrum, that's common. Like say you're sitting cross-legged or uneven all day or
straightening out
things like that. So when that happens and you have some torsion happening here, because of the connecting points to uterus, you can actually have more uterine constraint. So with babies, we always want to obviously make sure they have as much room as possible, because not only will it make mama more comfortable where they're not up in your ribs or in a weird breech position, but also it's necessary for the kind of birth that most mamas would want and a really successful birth. So that's kind of some of the reasons that a mama might seek out care about what's actually happening to the body. Now, also in pregnancy, we always talk about the 3 Ps. So that's passenger, passageway, and power. So passageway, obviously, if we're opening things up as much as possible and we're trying to get a really good position, then things are going to just flow a lot more easily, because, I mean, you might have heard before of a kiddo having a hard time getting over sacrum or getting over the pubic bone or things like that, or getting under the pubic bone. So it will literally open things up better. But also passenger. So baby always knows to get head down. They know that that's where they need to be. But if things are constrained, they might have a harder time getting into that position. So as much as, again, we can open things up and give them the best chance of getting into a comfortable position and getting ready for birth that way too. And then power, so that the nerves that are coming out of low back and innervating or talking to the uterus. So that's what's controlling it. Nervous system is controlling these functions. So the power that's coming from the nerves to the uterus when it's time to get the baby out and contractions are happening and it's getting closer to pushing, we want the best communication possible from here to the uterus. So because the low back sits on top of sacrum, when we have issues with that, if it's like a foundation, then you can get some rotation happening there and you can get some poor communication. So that's another reason we want to make sure all that's relieved so that we can have really good communication so that you're ready to rock whenever it's time. So not only, again, is it for comfort of mama, but also it's impacting so much with that. And when we talk about infancy care, not only is birth such a big process on an infant, but also if they're hanging out in a certain position for 9+ months, then they can already cause little patterns in their body. And most of the time it happens to be their neck because they're kind of in a funky position for a while. And obviously that's one of the reasons why, like when babies are breached for most of the pregnancy, they always are cautious of hip dysplasia and things like that, because it's just not a good kind of stress for their body to be in for long amounts of time. We want them in that good head down position and have as much room to move around and get as comfortable as they can. So.
Yeah, thanks. When would you, so I know with pregnancy, I mean, I always start as soon as I can.
Yeah.
Like as soon as I find out I'm pregnant, basically go to you. So what you would recommend as far as that, and then also specifically say somebody is in their 3rd trimester and they have not had chiropractic care so far. When would you say it's really important to really start for that like passage, like getting the baby to make sure head's down and all of that stuff?
Yeah. It's never really too late. Like I've had mamas start care like in 39 weeks for a certain issue, and it still can be really beneficial. Obviously, the sooner the better, because we're already establishing healthy patterns. We want good position. Things are a lot easier to open up when baby's not so big and kind of restricting things. And so it's more ideal when baby is still obviously very small, but any mama can definitely benefit. But definitely like the last month, I always tell mamas in the last month in my practice, actually starting at 36 weeks, that's when most people start caring about the baby position, depending on what kind of birth that you're going for. So if that's the case, we always want to make sure a little bit before that we're starting care. And then also 36 weeks is when relaxin really starts to increase too. So then you might notice a little bit more ligament laxity or loose ligaments, and you might notice more discomfort and more just tightness and things like that. So if we can have care before 36 weeks, usually in my office, 36 weeks is when mamas bump up their appointments because things are a little harder to keep in good alignment. So we check them a little bit more regularly. So that's a really important time for sure.
Cool. And I think you covered on a bunch of this, but I'm thinking through why someone would say, okay, I'm having this issue, I'm having this symptom. I need to see a chiropractor versus I need to, whatever, take a bath or see a massage therapist or go to my doctor or something like that. Like what would be kind of the trigger things to say this is something that a chiropractor would be able to help most with. Does that question make sense?
Yeah, I think it's tricky because I believe anybody can benefit for sure. Like if you think about the impact that is happening on the body, I don't think a lot of women know that pregnancy doesn't have to be uncomfortable. Like that, even going back to that, although like if any of these things happen, of course, like you should think about it and it's not too late and you can change your mind about these things. But also if you just do that for good support for your body, even with nothing like of a concern, it's just so helpful to support your joints, support your pelvis, support baby position even early on. And I have plenty of mamas who just come in for tune-ups and are actually quite comfortable through their pregnancy. So I think that is the beauty of it, is it can really benefit anybody. There's no one who, doesn't, I don't know how I'm trying to say that. There's no one that like, I'm like, you won't really need it. I mean, there's pretty much anyone can benefit. And so there's so many things that are the obvious, like, okay, for sure, if you're having these issues, they're not going away. That's uncomfortable. Like, don't just do like, oh, this is just pregnancy, it's going to go away. Like, there's a lot you can do for support. So of course, if you're having any pain or any dysfunctions happening, like, of course, seek out care for that. But really, you can just enjoy your pregnancy and become more comfortable. I promise you it exists.
What a crazy thought.
I know.
I love that. I've been thinking a lot lately about what is common versus normal.
Yes.
And I think so many people are like, this is normal. It's like, no, it's common. It's common because people don't know that they can have help, or people don't know they can have a healthier lifestyle, right, or whatever it is, but it's not normal. That doesn't have to be normal,
That is a very common thing in pregnancy where, and I hear it all the time, I'm sure you hear it all the time, where it's just like, that's just a pregnancy thing. And it doesn't have to be. You can be more comfortable. So
yeah, definitely. Let's see. So, do you want to move on to infants a little bit?
Sure. Unless anyone has questions. Absolutely.
Yeah. Any questions here? I'm keeping an eye, so feel free to shoot them in here. Because I do, actually I have a lot of questions about that too.
Sure. Yeah.
So let's talk about infants. And if anybody has more questions on pregnancy, feel free to go ahead and still put them in. We won't just bypass that because it's so interconnected.
Absolutely.
So, okay. Yeah. So infants. Okay. So mom had amazing care. We'll go this way first. So mom had care throughout her whole pregnancy, and she went to you every week, and you adjusted her, and the head was down perfectly and everything went great. And now baby comes out. What do you look at? Because I know for you specifically in your practice, when you've seen a woman through pregnancy, you also usually do a follow-up, right? With their
most
baby.
mamas within the first 2 weeks of birth bring their newborn in for a nervous system check, is what we'll call it. So I think to talk about infancy care in general, it's good to really back up. Hollie and I were talking about this earlier. Because chiropractic is usually seen so much as pain relief, most people will say, like, why would a baby need adjusted? Like, they don't have low back pain. And so backing up and talking about that a little bit. So I think most people would assume just chiropractic in general is pain related, and it is really good for that. Like Hollie was saying, it's really efficient for that. But in our office, we focus more on nervous system. So whenever I say that, all brain to body communication is being controlled by the nervous system. So every cell, tissue, organ in your body is controlled by the nervous system. And the nervous system happens to be housed by the spine. So of course that's important, but we really want to focus on taking stress off the nervous system. And what I mean by that is you have two parts of your nervous system. You have your fight or flight, and you have your rest and digest. So your fight or flight, you're sympathetic. If someone were to be chasing you with a bat, or you're being chased by a bear or something like that, you want your body to go into a high stress response so that you can either assess the situation and fight it, or get out of there and get to safety. And with parasympathetics, your rest and digest, you need that part of your nervous system to get into good deep sleep, good digestion, and a lot of healing and healthy functions happen from parasympathetics, which Holly is also super passionate about. So I'm sure you've heard it from this end too. So with that, you want those two parts of your nervous system to be in balance. So you want to be able to deal with stress, come back into rest. You want it to ebb and flow. A lot of times we get stuck in one more than the other. So most of the time we get stuck in sympathetic overload. You guys might have heard that term before, where you're just on high alert. You can't calm your body down. You're really stressed. And then it starts to lead to other functions being decreased. Like you start to get constipated. You start to have stomach aches. I mean, there's so much that can come with the headaches, whatever. So then talking about infant care. So if we want to take stress off the nervous system, and in our world, we think that when the body's ability to adapt, when there's so much stress on it that it can no longer adapt, that's when we have the problem. And we need to take tension off the body, the spine. We need to clear communication. So if you look at that with an infant, then they're going through a huge stressful event. And so I have my little, I forgot, I was going to bring my daughter's doll just so we can get a visual, but I forgot. So we get an elephant. So with the birth process, doesn't matter what kind of birth you have, whether it's vaginal and you have all this pushing, or you have a C-section and it's a ton of pulling, both happen to be a lot of neck tension. When we talk about the nervous system, the two areas in our body that are parasympathetic, so the rest and digest, are neck and cranials and your sacrum. So then when we look at a baby and what they're experiencing, and they're having all this stress on their neck, then that's a very parasympathetic area. When there's a lot of inflammation or trauma happening to that area, your body's actually going to kick into sympathetics. So in our world, our goal is always to clear out or help the body better adapt in that area so that it can come back into balance with that area. So for babies, we're checking a lot of neck tension and also sacrum. So that same bone we're talking about with here. And if you think about the sacrum, every time a baby's born, everyone's holding them all the time. They're putting them in swings. They're putting them in pumpkin seats. It's just a lot of, sorry, I need to be over here, a lot of tension on their little sacrum too. And of course, that's normal. Like you're going to be holding baby a lot, but they're not getting a lot of elongation time. So these two areas are super important to check. Now, if you think about why most people might seek out care for an infant, you're thinking of colic. So they're just super uncomfortable and no one can figure out, and they're just crying all the time. Like no one knows why. Or you have digestion issues where they're super gassy and they're having, like, they're skipping days in between bowel movements and things like that. Sleep issues, of course, like where they're super overstimulated and you can't get them to calm down into a good restful sleep. So you have all these things that are very sympathetic in nature. And so our goal is to always bring them back into parasympathetics by clearing out their nervous system and helping it to adapt better. And then on top of that, the obvious structural things. So one of the things we always tell mamas to check or dads to check is, have you noticed that when your baby is either laying down or even at a little bit of an incline, you notice that their neck pulls to one way or the other? And most of the time they don't notice it right away. And then we bring it up and then they come back next time like, oh yeah, it's always to the right. And if you can catch it really early like that, and a lot of kiddos do have that preference, a lot of infants do, because again, you had this pattern build up in utero where, like, oh yeah, they were always on my right side the whole pregnancy. And then you have the birth happening and all this compression or traction on their neck. There's usually a little bit of rotational aspect to their neck. And so you'll see them hanging out there and it's not really too noticeable at first, but then it goes and goes and goes. And then you have a full-blown like torticollis where they actually can't rotate to the other direction. You start getting flattening of the head. That a lot of times leads into breastfeeding issues. I was working with a mama earlier today that the baby's only nursing on her right side and the left's uncomfortable because the baby's having a hard time rotating right. And so she has to do football pose only. Like there's a lot of aspects that can come in with that kind of neck tension that, I mean, a baby can't tell you they're in pain, but there's a lot of signs if we're looking for them that they can let us know. And especially with nervous system, those are the kind of signs we're usually looking for with that imbalance.
Yeah.
So,
yeah, I think that's, I like that. I always love giving parents things to do at home. So like, this is what you're looking for. This is what you can do at home. And that's always, I'm always like, okay, I don't need, yes. Like in addition to adjustment stuff, what can you look for? B, what can you do at home? Because all of us, if I go to you, you're like, okay, I'm going to adjust you and then do this stretch and make sure you're doing this stretch. Babies, you can't do that with, right? Or like on a daily basis. So as far as parents, so I'm curious what you would say as far as what parents can do at home for that kind of thing.
Right.
Looking what they look for, and you touched on that. And then also, so anything else that you think that they should be looking for, or stuff that they can do at home to help out in between adjustments, just to make sure they're getting like the most they can.
Yeah, absolutely. There's a lot that goes into the assessment when you're in the office with me, because we're also going to be checking palate, tongue tie, lip tie, a lot of other things that could be leading to some of these issues. But as far as just mamas and dads seeing those things, if you have more questions about that, let me know, since I mentioned some of them. But things that you can do at home. So depending on what is going on, so say you are noticing a neck rotation, I always tell parents, like the first thing is being aware of it. So putting stimulation, of course, on the opposite side, even as far as babies are stimulated by light. And so if you have, like, say they're preferring right rotation all the time, then make sure that they're in the side of the car where the window is to their left. So it can be simple switches like that. Same with when their siblings are talking to them or anything like that, making sure it's on the opposite side. And then very gently, especially at the beginning stages when it's not pain, like they're not having a true torticollis and it's just a preference, when they're sleeping, gently turn their head to the opposite side and see if they'll keep it that way or if they come right back to it. And that would be, okay, you need to seek out some care. It's a little bit more significant than just correcting it at home. It's hard to say this one because obviously when you have a newborn, like you want to be holding them, you need that bonding time. That's good for like temperature regulation and milk production, and you need all those things. But having a little bit of time every day where they're laying flat, and it really doesn't have to be too long, but babies are born with a C-shaped spine. And that's why tummy time is so important, because it actually establishes their neck curve. So whenever they're born like that, and then we're holding them like that and putting tension on those areas more, even if you can just get a few minutes where you're laying them flat and letting their body unwind, and you'll see them, they like always stretch out and they really like elongate because they need that time to decompress too. So a lot of mamas and dads who spend more time just like making sure they get even a little bit of that time, or even laying them on their changing table a few seconds longer or whatever, really helps with like just letting them elongate after being cramped up for all that time. So that's a really big one too. And then of course, tummy time. So especially when we're talking about neck preferences and getting flat spots and things like that, as kiddos establish that healthy curve and start to unwind their body that way, you notice a lot less of that, especially like with the head shape, it will start to definitely even out a lot better too. So those are a couple off the top of my head for sure.
Yeah. I'm curious too. I've noticed several patients that I've had who are fairly young, who are kind of always in this arch, like they're very frequently in this, and it's really hard to get them out. And I do a lot of digestive work with that, because that's definitely an aspect. But what would you, like, you know what I'm talking about, when they're just like, they're not necessarily even crying, but they're just so stiff and they don't want to cuddle. They're the babies that everyone, the parents are like, oh, just cuddle with me,
Yeah.
Usually
that is dural tension. So you have connecting points through your cranials And obviously that's changing so much in babies, and that's something I always check as well. And then upper cervicals, and then connects the whole way down to sacrum. And so a lot of times if babies like can't get comfortable and keep arching, there's usually something happening in their cranials or their sacrum that they need the release from. Like they're just so uncomfortable. So that's where cranial work really comes in and helps a lot. And yeah, of course, when there's digestion issues too, where they're uncomfortable, but that seems to be common in gas and things like that, but also just unwinding their bodies. Oh, and I just thought too, going back to some things at home too, a huge one is what kind of seats and things you use at home. So like bumbos and things like that, where and bouncers, and where they're getting propped up really early without proper because those things shouldn't be used until kiddos are sitting on their own. But a lot of times at about 4 months, mamas are like, oh, but they just like seeing what everyone else is doing. So I propped them up on the bumbo and just shoved pillows in there or whatever. And it's really hard on their body, really hard on their sacrum, really hard on their hips. And so those are other things to be really cautious of at home too. Also, if they have a head tilt preference, bringing so much gravity into them by having them upright like that pulls on it more. So sorry, that just popped in my head too. No, we should probably talk about.
That's really good. Yeah, because I know I don't use a ton of those, or I haven't used many, except there was just one swing for Maggie and Everett. Yeah. It was just the swing. Like it would put them to sleep. Magic swing. It was magical. It was amazing. But I always was like a little nervous about it, you know? Yeah. But so is there anything, and that was like infant stage. Actually the buckle was broken on it. Maybe I shouldn't share this. So so as soon as they started even being mobile at all, I stopped using it. It was just like so young when they really couldn't move themselves. So I'm not asking, was I wrong? But I guess the question would be like, is there a better recommendation? Is there something other than mom having to just swing the baby and hold the baby for the entire night? You know, do you like product wise or
I say if your kiddo does love that, and if moms or dads need a minute for sure, it's just counteracting that time with some flat time, then like making sure then they are getting the time to stretch out and not having a little bit of compression. Because of course, it's like adults too, like there's sometimes we just can't change our posture. Like it's just going to be what it's going to be, whether it's like we sit at a desk job or whatever that we do all day. But as long as we have time to counteract it, like we are intentional about stretching, or we get adjusted or do things to reset that, then okay, like our bodies can adapt better, because it's all about adapting. So even if there's not a perfect situation for your baby, or they do love like the bouncers, because I definitely had times where my daughter would like love the little bouncer, like the baby Bjorn type things. Yeah. So I get that, but like we just want their bodies to adapt better. So as long as we're taking time to counteract that, help them unwind, then those things are going to compound so much. So
okay, that's helpful.
You're a great mom.
Makes me feel better. Let's see. I was thinking. I have a question. Sorry, I just keep shooting my personal questions here, because when you're talking about elongation, and kind of the position, you know, that you always have the baby in. I remember hearing somebody talking about when I was pregnant with Maggie, so 4 or 5 years ago now. They were talking about how bad it is to, can I use your elephant? Yeah. To basically change the baby's diaper like this, where you're like picking up like that, which is how every parent changes a baby's diaper, right? Like they have a poopy diaper and you go higher and higher and higher to where you're trying to wipe up their back. Do you agree with that you shouldn't be doing that? Or is it again, they can do this for a minute while you're wiping and then counterbalance it basically?
Yeah. That's a hard one too, because some kiddos are more predisposed to things like hip dysplasia and things like that, or even just putting, you know, obviously that's a lot of pressure on their back. So they always recommend like rolling instead, and then like sliding it under, and things like that. So that's a hard one to answer. Yeah. Again, it's like, I mean, you know, your kiddo, you can see how they're responding to it, but most of the time I would think that's not as big of a stressful incident, as long as they're getting time to kind of unwind otherwise. Yeah. Okay.
So rolling probably is the safer option.
Yep. Just rolling over and slide it under. But I mean, it's hard. There's a lot of things to think about as a mom. Like you don't want to drive yourself crazy, and a dad just having to overanalyze all these things. Yeah, for sure. That's why you need good people in your corner and good team members to do like motherhood and fatherhood with, for sure.
Yeah, absolutely. So, I was going to ask too about, because you mentioned like babies are not going to be able to tell you when they're in pain, right?
Mm-hmm.
So like that whole thing of really feeling a baby's body and seeing a baby and looking at them and
Mm-hmm.
knowing what their body is telling you.
Mm-hmm.
I love that aspect. So I don't know, I was trying to think of something more with that, because I find that so fascinating as far as listening to the baby's body. And I guess you did touch on that. Maybe I'm being a little bit like
okay. We can
over,
talk about
but
it
just
again.
as far as with parents being able to see, I guess maybe some like top things that you would say with that, just like listening to like looking at your baby and being able to know, because like you were saying with colic or that kind of thing, like, do they just need to rock in my arms, or is this something that is a deeper thing that I should explore? I don't know. What are your thoughts?
Yeah. Well, first off, if you're ever just questioning it and not sure, just go get them checked. Like that's okay. You can just get them checked and just see. And again, have that extra set of eyes and support. Like there's no reason to stress yourself out and feel like you have to know everything about that for sure. But there's a couple of things. So it's interesting, even in practice, you can tell you guys have probably seen the baby or have had the baby that is just like so uptight, and you're like, you're a baby. Why are you so uptight? You should be just like soft and squishy and just relaxed into my arms. And so sometimes it's obvious. Sometimes it's just like one of my new babies today. It was like, she never stops crying unless she's breastfeeding, and I mean, you do have normal newborn things happening, but baby shouldn't cry all day, every day. Like they're trying to tell you something and they're uncomfortable. So there's some obvious ones like that. But going back to just the nervous system stuff and just when your baby might need some extra support. So besides seeing structural stuff, besides seeing like a kiddo have a high shoulder or a neck rotation or something like that, or sometimes when you lay them flat, like on the changing table, you'll literally see them in a C shape. Like that happens a lot at first as they're kind of unwinding. So those are some obvious structural ones. As far as nervous system, like when they're communicating to you, babies obviously at first have a hard, like there's not really a routine necessarily at first with sleep, but you can tell the difference between like, are they just like high wired and they can't fall asleep, or are they, because a baby should be just sleeping, pooping, and eating. Like that's what they should be doing. So if they're not doing any of those things, if they're having the hardest time settling down, or they startle and wake like super easily, like where you can never get them to just like fall asleep, because the second you put them down or whatever, you move positions, they wake back up. Those are a big nervous system thing. And some other time we can do a talk on primitive reflexes and things like that as we go, but those are things to keep an eye on. And then you have latching difficulties, uncomfortable like breastfeeding, or preference of one breast over another. That's a good time to bring a kiddo in. If they're skipping days, like I know there's a lot of theories on this, but I don't buy into like the breastfed babies can go 5 days thing. Like if you went 5 days without pooping, how would you feel? Like there's no reason to believe that a baby wouldn't feel uncomfortable too. So just keeping an eye on their schedule with that, like how often they're going. Do they pull their knees up? Are they uncomfortable? Are they spitting up all the time? That's a big sympathetic thing where they're just having reflux all the time, and you can't figure out why. And maybe it's not diet related at all, and it's something that they can't calm down. Those are some of the big ones for sure, but mostly it's just eating, sleeping, and pooping. They should be able to do really well. So if those things are not within reason, then it's a good time to just go get them checked and see if they could use some extra support.
Yeah, for sure. Yeah, I like narrowing it down to that, because that's pretty much everyone that I referred to you. Like
eating, sleeping, pooping.
They're not eating, sleeping, pooping. Like we can work nutritionally on this. We can work on the gut. We can give them the nutrients, and let's incorporate chiropractic, because I like working together with those two is so beneficial. I remember you telling me that you I don't know about frequently, but regularly have kids just pooping on the table, where you're like, you adjust and they haven't pooped for a while, then they adjust and it's like, boom,
push the poop button.
The parents are like, thank you. Like that can be, so helpful. And that's for my kids that I see, not my kids, but my patients that are kids. constipation is frequently an issue because they're generally the ones who are coming to me have a lot of toxins built up in the body, and the body's having a hard time. The body's detoxing, working through, and that's what we're working through, working with nutritionally. But it's hard to, sometimes the body just is having such a hard time actually expelling those, which is so important, because if you're having, you're doing all the hard work nutritionally and lifestyle wise, and you're removing toxins that could be introducing, but everything is just storing inside. I mean, that's just, I mean, you're not, there's a lot more that needs to be done to actually get it out. So that's one of the main things I love referring over is to, and actually let's help that parasympathetic aspect. Let's get the body aligned so that the bowels can actually do what they need to do. The brain stimulation, all of the connections you were talking about can actually work. So
and that's like the whole goal isn't some like magical adjustment or like that even is it. It's that it's helping the body adapt better, because the body is a self-healing organism. So if you can take stress and tension off the body, it will do its job. And it so matches up to what you guys are doing too, nutritionally, like taking a stressful load off the body and giving the body a chance to heal means the body adapts better. Like, it's amazing and incredible what our bodies are capable of doing and healing and reproducing. And like, especially when you guys work with the gut, like what it's able to do with that. But you have to take the stress off the body. And like, life is stressful. Things are stressful. Like we live in a toxic load environment. There's physical, chemical, and emotional stress. So we have all these three components that come at us and even come at our kiddos. And just to take that tension off and help the body adapt. Same with you guys nutritionally. It's just powerful, because then your body can self-heal and self-regulate and do what it's supposed to do.
Yeah, absolutely. And I think that's a lot of the people that come to us believe that, like we want to do this. We want to raise our kids, healing them the way the body is supposed to act and heal itself. And, using basically what God has given us, the body itself, and, good food and that kind of stuff to be able to heal. Right. So I think a lot of people really believe that. And it's just the incorporating all together, a couple of different modalities sometimes that we really need to piece together to help, because unfortunately it's true. We don't want to live, we can't live fearfully that there's, toxins and stress all over us. But it is more prevalent now. It's exponentially more prevalent than it was, our parents' generation and before that. And so it's really taking, okay, this is what we have to work with, but the body, the truth that we still know is that the body still is self-healing. The body is intuitive and it's smart. And if everything is linked up, our bodies were created to work well. And so we can help our bodies, get back to a state of working well. And adapting better, so that when stress hits, because inevitably, no matter what three forms of that stress hit you, sometimes you can change it, like sometimes physically, like we're talking about with pregnancy or with infancy, like you can do things to physically take stress off of your body or your infant's body, or chemically, emotionally, like you can change some of that, but you can't change everything. But can you get your body in a position by making healthy choices, by getting tension off your nervous system, by eating the proper things and supporting it and nourishing your body? Like, can you add in these things so that your body, when it does get hit with those things, like the wellness line, what you weren't starting here, like you were starting here by supporting your body with all these healthy, good choices. And then it's like, oh, I'm here. Okay, I can build that back up. I'm not here, which is sickness and all the other stuff that comes with that. So if you can adapt and support, then it can just change so much of how we do heal. And totally. Yeah. And how cool is it to be able to start from not even just infancy, but in utero? Yes. I love that. Like pregnancy, I think of a lot, and it may be a little bit different, but a lot for me being pregnant, like, okay, let me kind of not get through, but let's enjoy this pregnancy, like through as few symptoms or discomforts as possible. Right. But I know especially it makes me really excited to be able to be, very foundationally helping my child right now. Right now, even when he or she, I don't know, is just, 18-ish weeks around there. And then what we're going to be able to do when he or she actually comes and we can, we can see them, like, it's just such a cool thought. It's such an empowering thought for me to be able to know that I can do that for my child right now. So,
it's huge.
Yeah.
And setting them up the best way you possibly can.
Yeah.
Yeah.
So thank you. That was great. Is there any final thoughts you feel like you want to say?
I don't think so, but even
if
you think of questions later, feel free to reach out to me.
So give us your info as far as where people can find you. And I'll put it, once we load this up to YouTube for replays, I'll have all the information in there too. But go ahead. Our
website's kindredcolorado.com. And our Instagram and Facebook is all Kindred Colorado. So that makes it easy. And there's an email button right on our website. And feel free to always reach out and ask questions. I'm happy to answer them, have a consult if you need it, whatever. I'm always happy to help. So, yeah. And again, she is right downstairs. So if you've been to the North Glen Beable Clinic office or Beable Clinic, she is here. So you know exactly where to go. Reach out to us and we can put you in contact if you guys need anything. We are here to help. So thanks for being here. Thanks for having me, guys.